I'm honored to join you today at this year's United Nations International Day Against Drug Abuse and Illicit Drug Trafficking. The observance of the day goes beyond rituals, and it's a highly important commemoration of the joint, solemn, and unwavering commitment of UN member nations to take and strengthen action towards achieving a world free of drugs. And this is an important objective indeed. Drug abuse has become a global public health and socio-economic challenge. And it places a huge burden, as all of us have heard already, on our healthcare system. And it portends grave consequences for our young people and the productivity of our labor force. And it undermines the security of our communities. The UNODC reports that drug use was responsible for the death of almost 500,000 people in 2019, and drug use disorders resulted in the loss of 18 million years of healthy life. The 2018 National Drug Use Survey also revealed that Nigeria, at the time, that there were about 14.3 million drug users, of which close to 3 million suffered from drug use disorders. This figure represents a 14.4% prevalence in Nigeria, prevalence rate in Nigeria, which is about 3 times the global average prevalence rate of 5%. The UNODC also, in its 2021 World Drug Report, projects that by 2030, the number of people using drugs around the world will rise by 11%, and by 40% in Africa alone. Of course, this is a disturbing projection because as the country with the largest population in Africa, this implies that Nigeria's use of drug abuse prevalence will rise substantially, especially considering the proportions that we are leaders in terms of population. In the past 17 months, the NDLEA, we're told, has recorded over 17,647 arrests of offenders, including 10 drug barons. And I'm sure that that number increases every day if you're following the news, with over 2,369 convicted persons and over 150,000 kilograms of drugs that have been seized within the same period. So the statistics show that 5.5% of the population aged between 15 and 64 years used drugs at least once since 2019. This is precisely the age bracket that we cannot afford to lose to drugs. And if you look at the theme of this year's International Day Against Drug Abuse and Illicit Drug Trafficking, it turns our attention to a rather different dimension of the problem. This is addressing drug challenges in health and humanitarian crisis, the increasing trends of drug abuse in areas of conflict and in post-conflict settings, such as in IDP and refugee camps. And this is of special concern to Nigeria, as we are in the throes of civil conflict and terrorism, resulting in the displacement of large numbers of our population.